Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Effective for weight loss, and now they are also being touted to be effective for other items such as addiction and other items. And so the article actually talks about some of the important side effects that occur, and they also mentioned, because one of the things that Mr. Buchanan had asked about was the expense, and they indicated that it runs about $1,500 a month out of pocket. Uh, uh, but apparently it's been probably the most common drug used these days for diabetes and weight loss. And it seems the use is expanding. Last week we talked about its impact on the liver, affecting what was previously untreatable liver disease that was non-alcoholic. And now we're talking about it being effective for addiction as well. So it's going to be a drug that is probably as commonly used as aspirin, but much more expensive. But it's something that we all need to be aware of that's going on with people. But this predominantly has involved people under the age of 75, and actually under the age of 65. So, I'm sorry? Oh. So I can't understand whatever you're saying.
Somebody's not muted.
Oh, okay. So anyway, so we all should be aware of the new weight loss drugs. You see them on television with many different names, Wegovy and many other names. They also talked about the impact of Obamacare, and the fact that we now only have 8% of the American population that is without hospitalization and insurance coverage for health care. It used to be 16% of the American population, is now 8%. Also, interesting article that said the cervical cancer deaths among young people have dropped significantly, primarily because of the HPV vaccine. So be sure to encourage your grandchildren and great-grandchildren in school to get that vaccine, particularly well, you can't say particularly the women, even though it's killing the women. It's the men who are spreading the disease. So the men and the women, but it's particularly the women who pay the price of human papillomavirus. So just information. Also, fascinating article on an 88-year-old lady who decided, I guess, 14 years ago to go and live on her own because her husband died. And so she's 102 years old now, lives in New York and lives alone and is thriving. And it talked about a number of people who are so blessed who live to be over 100 and are independent. And it was a very interesting article that talks about how many there are who are actually older than 85, but have to have a cane or some support. And this lady goes shopping by herself and takes the bus and is doing very well. There's an exception to the rule for 102, but anyway, it talks about the fact that we now have more resources for people who are centenarians, and actually people who are over 85. And the resources now are much more than they used to be. Anyway, those are just some interesting articles that the Post was dealt with on this Tuesday. Any comments about any of those things before we start the articles?
Good morning, everybody. This is Sylvia. Dr. Callender, I thought I read something where the incoming RFK guy was thinking about stopping vaccination for children. And I was like, okay, have you heard anything like that?
That's correct.
Oh, okay.
Yeah,
Oh.
he's anti-vax. He's an anti-vax guy. The only thing that's positive about him is that, I mean, as my perspective, is that he's very much concerned about junk food and highly processed foods. And so he will do a lot about that. But yes, he is anti-vaccine, and he's going to dramatically change everything. The focus on acute diseases will be eliminated, and the emphasis will be on chronic diseases. And yeah, I hope we will be on preventive care as well. But anyway, it's going to be a new day for all of us.
And another thing, I was talking to a girlfriend this week, and she was mentioning her daughter who's pre-diabetic or diabetic was having a hard time getting the medication that people are using for weight loss. And like she's on a waiting list now because I guess so many people are buying it or getting
That's
it for the
correct.
weight loss. She's having a hard time and on a wait list to get it just for her actual medical condition.
That's correct, for diabetes. It becomes so popular that the diabetics can't even get the medicine. That's correct.
Wow.
Dr. Callender, with this weight drug becoming so popular, as it becomes more popular, do you think there's a possibility of the cost dropping?
Yeah, it usually does. Yeah, it usually does. As the drugs are used more often, usually the price goes down. Right now, it's about $1,300 a month out of pocket. And usually, as time goes by, the more it's used, usually the cost goes down. But as you had mentioned, Sylvia, there's people with diabetes have trouble getting the medications because so many people take it for weight loss that the diabetics can't even get it. So, anyway, it's a.
Dr. Callender, are these drugs made in the USA or
Yes.
are they imported?
Yes.
Okay, good.
Yes.
I was thinking about the tariffs coming, but if they
Yeah. So, but my expectation is demand will get worse because it's been effective not only for diabetes and weight loss, but also is now being championed for addiction and for liver disease as well, and the list is growing. So it's not going to get better. It's probably going to get, the demand is going to get greater. But maybe as the demand gets greater, maybe the price will go down. I don't know. We'll have to wait and see. And I think there's been an incredible list of people who have felt that Kennedy, who was Trump's selection for the running health in the United States, there'll be a lot of fighting, but I think after all is said and done, he will probably still be nominated for that position. That's my guess, because it's a Republican House, it's a Republican Senate, and the president is Republican. So I expect that there'll be a lot of fussing and fighting. But the bottom line is, I suspect he'll be nominated, and we will have to endure 4 years of interesting differences in opinions.
Dr. Callender, one last thing in the article you read about the Obamacare and knowing that more and more people are covered with insurance. Did it mention anything about this conceptual plan that the president-elect is thinking about?
No, because we know he is against Obamacare.
That's what I
So-
was saying. So did it mention that he has a better plan that will improve?
No,
what's already-
this was only talking about the positive impact of Obamacare. That's all.
Oh, okay.
Okay, we can start the articles. This was a interesting article that talked about that irregular sleep patterns increase the risk for heart attack and stroke, particularly if you don't get the amount of sleep that you're supposed to get. In other words, if you get 7 to 9 hours of sleep, the likelihood of an increased risk for heart attack and stroke is not as great as if you get a regular sleep pattern and you don't get the amount of sleep that is recommended. But the data that they have here, it's based upon a number of, you can see it, 72,000 people aged from 40 to 79 years in the UK. That doesn't talk about it, the United States people of color. But it does say that irregular sleep patterns, which are not associated with the 7 to 9 hours of sleep that is recommended each day, is associated with increased risk of heart attack and stroke. It also identifies that even if you have the correct amount of sleep, you still have some increased risk if you have irregular sleep patterns. Any comments about those of you who are irregular sleepers and who don't sleep 7 to 9 hours a day?
Yeah, my comment as a musician, I guess I would fall into irregular sleep pattern because gig nights are late nights, so I'm not in my regular sleep rhythm. Like typically, if it's not a gig night, I'm asleep by 10, up by 6. That's 8 hours. On a gig night, it may be 1 to 1 in the morning until 8 hours later or 7 hours later. But it's hard to get the full 8 hours if I'm off my regular sleep pattern. So does that qualify as a regular sleep?
Well, that's an interesting comment because that probably affects many of us on this call who are in the music industry and other industries. And it only addresses the fact that if you are an irregular sleeper and you get the amount of sleep that you're supposed to get, that the risk for the heart attacks or a stroke is minimized, but it's still higher.
Mm.
Interesting, because interesting to have this looked at it in the United States as well as UK to see how the non-traditional sleepers, especially musicians and people who work odd hours, but this doesn't. It only says that if you get to 7 to 9 hours, your risk isn't as great as those who have irregular sleep patterns and don't get 7 to 9 hours.
Watch out for where you are stepping.
Bets, Janice.
Mhm.
Janice, you had a comment?
No, I didn't. I was just joining.
Okay. All right, John, if there are no questions, that's an interesting topic that applies to all of us, I think. So, this is an article about TikTok's latest counting sleep at night to get you better sleep. 1 to 3 adults are not getting enough sleep, and they talk about different ways of trying to help the insomniacs to get the 7 to 9 hours of sleep that they need to get. And this is
Tape in your mouth.
one of the sleep gadgets to talk about taking supplements and other things. So as you go down the article, you see that there's a number of things that TikTok is recommending, including sleep tracking apps and devices rather. Well, drinking cocktails, mouth taping. I don't know anything about any of these techniques, so I don't know if any of you have adapted any of them.
Too much can also.
Any of you tried any of these? Those of you who have good sleep patterns, then it's not an issue. But for those who don't, Mr. Tatum?
Yes. What is your opinion on Amidon?
I'm not familiar with that. Was that a drug or something?
Yeah, yeah. Ambien. I'm sorry, I said the word wrong.
Oh, Ambien. Oh,
Ambien. Sorry. Yeah.
Ambien is a kind of a dangerous drug because it causes you to have hallucinations and cause you to do strange things while you're sleeping. So I used to use it a lot, but I had so many patients had side effects. People got up at night and didn't know they got up at night. They out driving, doing all kinds of things. So
Oh, wow.
it's kind of a drug that if I'd recommended it, I'd take it maybe once a week and not regularly. And the side effects are scary, especially if you take it, and it's habit forming, especially if you took it every night. I don't think, I think as a drug, its side effects have to be considered. And so I'm not a fan of Ambien
Thank you.
based upon the side effects that many of my patients have had. Some people got up at night and did some very strange things. Started cooking and doing things they weren't accustomed to doing.
Mm.
Mr. Buchanan?
Yes, as far as the tools that you can use, I use and I mentioned this before, I use a sleep mask, which cuts down the light that comes in. And even if you're next to a window at night, you still got sunlight and moonlight coming in at night. As soon as the sun rises, that can come in and cause you to be aroused. So I use a sleep mask. It's like a blindfold. And I also use CPAP. That definitely helps my breathing. And since I use the CPAP, I can pull the blanket all the way over my head, and that also cuts down the light impact, because the light coming in can arouse you as well. That's it.
Any other things you want to share? Anybody else want to share anything else?
Yes, with the Ambien, my mother was on Ambien and she was doing strange things and saying strange things, somebody in the bed with her, and one night she woke up fighting, and one night we just found her walking around in the house. So we had to end up asking the doctor to remove that medication from her list.
Thank you for sharing. Pearl, you're on
Pearl,
mute. You're muted. We can't hear you.
No, I didn't have anything to say. I accidentally hit the wrong button on the
Oh.
computer.
Okay. All right. If there are no more comments, we'll move to the.
Yes, I didn't put my hand up, but before we move on, I saw something in this article about if you sleep too much, but you went past it kind of fast.
Well, it's well known that when you sleep long, they have studies that also looked at people who sleep longer than 9 hours, and they felt that sleeping too long was as problematic as not sleeping enough.
Oh, okay. I wanted my husband to hear that.
Okay. All right. Go to the next one. This is an article, a wake-up call for us. Last week we talked about the fact that life expectancy in people of color was better than ever. And that's something to take delight in. But when they looked at the life expectancy as expected by 2050, is expected that we would have dropped from a position which isn't very high anyway, which is in the 40s, to go all the way down to the 60s, so that we have to do something about what we're doing now, because our life expectancy is going to be dropping compared to other countries. And so we need to really, and this may bode well for Kennedy, because he's talking about addressing issues like ultra-processed foods and other things that are really part of why our life expectancy has been mentioned many times. Obesity is the plague of the globe, not only of the United States, but of the globe. And this is one of the reasons why our life expectancy is not any better than it is. And so maybe Kennedy is getting in that position, may change things in our focus, to focus on decreasing the mad rush we have for junk foods and ultra processed foods. And you can see this graphic here that looks at how we compare to other countries, and how we're going to be even worse as we get to 2050. So the time is now for us to change our habits. And, you know, if you watch television, it's just kind of scary, because there's so much drinking and so much carousing going on that that's one of the things. You know, we talk about social media. That has its issues, but the commercials on television are just frightful. It's almost like alcoholism is the best way to handle everything. And then if that isn't good enough, then get junk food. Junk food is very wonderful. So in many ways, what Kennedy can do, if he does something positive, is to do away with this obsession with alcohol and junk food. The end result is an increase in alcoholism and obesity. We now are becoming happy about people who are overweight, and that's leading us to earlier deaths. So
Dr. Callender, my opinion about the overeating, it's a symptom to me. It's a symptom of the anxiety that's going on in general, and people are eating to their feelings. You know, when when you eat, you feel good, and then when you eat more, you think you're going to feel even more more good, and then it turns out to be a problem. You know, with weight gain. So that's just my opinion about that.
Any other thoughts you want to share? Anybody
Yeah,
else?
my thought would be is that not so much overeating, but our the way that our food is processed in the United States. Um, there's a prevalence of high fructose corn syrup in a lot of our foods, and that causes a calorie is not a calorie. You eat the something with high fructose corn syrup, you're more likely to gain weight than a product without it. Uh, but it's very addictive, and it's in everything. And so I think that's part of the reason why we're a fatter nation than across the Atlantic.
Well, that's one of the areas that Kennedy is going to focus on. So that's a plus for Kennedy. Okay, for no other comments, let's go to the next article. This article talks about telehealth versus in-person diabetes care, and it makes a plea that telehealth is competitive to in-person diabetes care. So it's not to say that one is exclusively better than the other, but they both can be used to keep people healthy. And for people who wouldn't otherwise get health care, it may well be that the telehealth opens the door for younger people, and maybe more Black men would go to the doctor if they had telehealth. So that there are, of course, advantages to having a personal doctor see you, but there are also advantages to have those people who would not see doctors at all to see healthcare as a consequence of telehealth. And the new wave is to increase the provision of coverage for the physician and the healthcare provider. Much of this is now a positive consequence of COVID, and which made telehealth to be funded more by the government, and also to be more used by physicians and patients. Any other thoughts or comments?
I have a question, and John Buchanan, would you take my hand down for me after the question? And my question, Dr. Callender, is telehealth cheaper? I think it should be, since it's technology based and we're moving into the age of technology. And so is telehealth cheaper?
Well, actually, what they're trying to do is to make telehealth always was cheaper, but the goal was to increase the physician reimbursement for telehealth. That was the goal, to so that you would get the same amount for telehealth as you would for a personal visit. Right now, it's still cheaper, but it's much closer to the reimbursement that's associated with seeing a doctor in person. Betty?
Yes. Te- I I feel like you might as well go more with telehealth, because when you go to the doctor these days, all she does, or I say she because my doctor is a woman, but all they do is come in and talk to you anyway. I mean, they have someone else to take your blood pressure, and a lot of them want you to do your blood pressure at home. So if you're doing your blood pressure at home and reporting to them, it it saves you a trip of going to the doctor. So
Well, that's only true if your doctor doesn't examine you,
yeah,
because blood pressure is just one of the ways that we examine you. We examine your heart and lungs and legs and all that. Well, at least physical examination is still part of what happened, is supposed to happen
supposed to
when you,
happen.
when you go to see the doctor. But if the doctor doesn't examine you at all,
That's
then
right.
you're right. Yeah,
Yeah.
then your point is well taken.
Doesn't examine.
But I must admit, and I'm horrified that many of the physicians don't examine patients, which is frightening to me. But is a sign of the times. They want to make everything uh, associated with technology, but technology does not replace the physical examination. It supplements it. And remember, 97% of a diagnosis can be made by history and physical examination. Uh, and of course, to supplement that, you need the X-rays, the imaging, but it doesn't replace completely the history and physical examination.
Dr. Callender, is there some reason why doctors are scared to touch you? And when they do touch you, they ask permission. Can they touch you? Or can I go up underneath your blouse to listen to your heart? And they explain every step of the way when it used to be, I'm going to listen to your heart. But now they're very polite. And it's just like, can I touch your foot to check, test for water retention and all that? They're very polite, or they're scared to touch you.
I have no idea why that is the case. It is clear that assault and battery are something that physicians are excluded from. And so the need to do that is there primarily because of the sexual issues and not because of medical issues, but because of gender issues and the like. So being courteous in terms of applying that to your professionalism is okay, but that doesn't mean that you don't do a physical history and physical examination. However, your observation is something that is becoming more and more common because of the concern about sex abuse, and the physicians are more wary of being accused of assault and battery.
Dr. Callender, we talked about an article a long time ago about having written permission to test somebody below their belt.
No. For vaginal examination.
Yeah, that's what I'm talking about.
It's not just below the belt. It's vaginal examination specifically. And that is something that Medicaid had introduced, yes. But it was for pelvic examinations, yeah. Any other comments you want to share?
Yes, Dr. Callender, people my age have Medicare, and there are certain stipulations of how often you see a doctor and so forth and so on. But for regular yearly annual physicals, used to be touching, but it's more a sit and chat now. Have you done this or have you done that? Do you have this or that? And I just I don't like that. You see them once a year, and they call it now a health check instead of a physical. And I don't understand that. Medicare pays for that.
I agree with you that we're going backwards rather than forwards. And the price we pay is an expensive one. I
Yeah.
also have recognized that for people of color who are over 45, the likelihood of having hypertensive problems and kidney disease is such that proteinuria should be part of the examination, but it's often not. And it's so in addition to history and physical examination, which is becoming less and less people doing it, they also are not doing urine tests for protein, which is I think is almost criminal. But so your comment is well taken, and I think we've gone backwards instead of forwards.
Dr. Callender, another name that is used is a wellness check.
Yeah, yeah.
Yeah, we can call it whatever you want, but it's still not done well. We're going backwards along those lines, and that is particularly important for people of color because we have more of these diseases than any other group. So if they want to do that for the Caucasian population, they can go ahead, but they should not be doing that for people of color. So we've got more diseases than any other ethnic group other than the Native Americans. Betty, you had another comment?
Yes, going back to what Carol said earlier about the doctors being polite and everything. Does it matter whether they're touching you, actually your physical body, or touching your clothes? You know, to find out your heart or your
Well, as far as I'm concerned, when you go to see the doctor, you should, you know, your clothes should be off.
yeah, well, that definitely doesn't happen.
Yeah, well, you know, so we're moving, you know, in our efforts to go towards AI, we're moving it in the wrong direction.
And another
AI is supposed to supplement, not replace.
and another thing, as far as what you said about you know, the probability of sexual abuse. I've seen doctors, and even our doctor, that has another person in the room with them when they're doing the exam, so that you can't say, you know, that they're protected from having an abuse claim.
Yeah, you're right. If you have somebody in the room, then there's no excuse. John Buchanan?
Yes, Dr. Callender. Excuse me. I noticed that with my previous physician, who was a female, I used to have a very thorough physical exam, touching all over my body, and the digital exam as well. I've switched to she retired sadly, and this new doctor who's a male hardly touches me at all. Which I mean, it's a bad thing, I think. And also the blood work that I used to get mandated prior to an exam, recently it's more been like an afterthought. So I mean, I've had to go in and set up blood work, for prior to my physical. So my physical is coming up in 2 weeks. And I had to actually go in and set an appointment with the laboratory to get my blood work done. So you want me to remind my doctor to order the, the blood protein? Is that
Urine, urine,
urine
urine for protein, right?
urine protein? Okay.
Yeah, that should be done. But unfortunately, that is not required, which is to me a step backwards for people of color, because we have more of that problem than any other ethnic group. And so as we get over 45, uh, more women have kidney disease and more men have kidney disease. And the earliest manifestation of kidney disease is protein in the urine. And so if we're not doing that, what happens is that instead of finding out at 45, you find out at 65, and by that time you may be beyond stage 3. And beyond stage 3 is not reversible, whereas the first 3 stages of kidney disease are reversible.
Is there another test that I should ask for, like the PSA? Should I ask for that?
I think, well, yes, I think up until the age of 80, I think it's recommended, particularly of people of color, PSA. Yeah. And white doctors don't believe that that's necessary, but I think people of color and our likelihood of getting prostate cancer is greater than people who are not of color. So I would say yes, PSA and urine protein.
All right. Thank you, Doc.
But your observation is a sign of the times, and it seems as though we're going backwards rather than forwards. Any other comments on this? Well, let's go to the next article.
One comment is the protein test is that the same thing as
Same thing as what?
I said is the protein test for urine, is that the same as the creatinine test?
No.
Okay. What's the difference, please?
Yeah, the creatinine test is something that occurs. In other words, the creatinine is a blood test.
Okay.
And the creatinine level, you want to be around 1. And often, long before the creatinine changes, the urine protein is found in the urine. It's the earliest manifestation of kidney disease, whereas creatinine is a later manifestation of kidney disease. And so you want to find out about the kidney disease as early as possible so you can do things that will, you can get your blood pressure normalized, your weight normalized, and you can be sure that your diabetes is under control. Those are things that need to be done if your urine protein is elevated. But at the time that your urine protein is elevated, your blood or serum creatinine is going to be normal. So the earliest manifestation of kidney disease is not your creatinine, but is your protein in the urine. And if you don't look for it, you won't find it.
Dr. Callender, should I request a colonoscopy? I haven't had one in a long time.
Every 10 years, if your last colonoscopy was normal, up until the age of 80, they recommend every 10 years.
Okay.
If you have a positive colonoscopy, then they recommend it every 5 years. Okay.
So what denotes a positive colonoscopy?
If you
I
find
know
the
the polyps
polyps,
mhm.
polyps or cancer, right?
Yeah.
Because polyps turn into cancer.
Sure.
Okay. This article just confirms that if you have diabetes, normalizing your blood pressure helps avoid some of the complications of diabetes, of cardiovascular disease in diabetes. And therefore, having a systolic target of 120 is very desirable, rather than the standard level of 140. And this study demonstrates that. Of course, this was not an American study, and you have to be cognizant of where the study is from. And this study is not an American study, but it's an important study that identifies that if you have diabetes, the lower pressure requirement of 120 is more desirable than the blood pressure of 140. And the consequences are that your diabetes is better controlled when your blood pressure is better controlled.
Dr. Callender, what is the sprint?
Sprint. I don't know what that sprint trial they're talking about, except that this is a American trial that showed that if you lower the blood pressure to 120, that cardiovascular complications were less heart attack and less stroke when you had a blood pressure of 120 or less. That's what the sprint trial showed. That was the American trial, whereas this trial is done in another country. And you see the different international trials. Chinese trial, other trials. But the bottom line is that most of these studies are suggesting that the target should be 120 rather than 140. That's the bottom line about all of these studies. We should be shooting for 120 millimeters of mercury rather than 140. The old system was 140 over 90, but these new studies are suggesting that target should be 120 over 80. And that there are significant benefits for trying to get your pressure at 120 over 80. One of the things that most of the recent studies haven't looked at is the benefit of the medication that we take that are lower the cholesterol. And I think that that's something else that needs to be looked at, along with the blood pressure, but also the cholesterol lowering effects, which many people are on medication, except for Betty Baylock, who's on no medications. But most of the rest of us are on medications, one sort or another, for blood pressure or for cholesterol and other things.
Dr. Callender, I just did my 109th blood donation on Friday, and they took my blood pressure, and it was pretty good, as you noted, 129 over 66, and that was after I was swimming earlier in the day. So just to reinforce the fact that exercise, I swim 1.2 miles 3 times a week. That exercise really helps my blood pressure because it had been pretty high. I had the white coat effect, going into the doctor's office. My pressure was usually high. I mean, it'd been 140, 150 sometimes. So exercise helps that.
Thanks for sharing. What was it after you performed with the Handel's Messiah? Did you check it after that?
I did not check that one. I need to do it more regularly. Check.
But that's it's so wonderful to hear the wonderful consequences of your swimming and how it affected your joints and everything else. So that's thanks for sharing that those wonderful experiences with us. Even though most of us can't take advantage of the swimming that you do, we're jealous though. Yeah. Okay, let's go to the next article. And this is another interesting article that taking blood pressure medications linked to higher risk for acute kidney injury if you only take it when your blood pressure goes up. That's what this article is about for veterans. And they said if your blood pressure went above 140 and you needed to take medication, that this was a sign that you were likely going to develop kidney injury. And I looked at the risk, and it was much higher for MI as well as other cardiovascular complications. Suggesting that there's no such thing as asymptomatic blood pressure elevations. If they're elevated, they should be controlled. But these are limited studies, so and only in veterans. But thought I'd just include it in so that kind of to eliminate the concept of asymptomatic blood pressure elevations.
So, Dr. Callender, does this only happen in the hospital?
This study is only done in the hospital here. Okay. That's why limitations are great. And there's so many things that influence pain, stress, and other items that limit the applicability of the study to anything else. So, now, this is an interesting article that talks about certain diabetics drug classes may reduce the need for gout. And here again, we're talking about the glucose inhibitors, that they decrease the uric acid level. And this then results in less likelihood of gout. And those who've had gout appreciate the fact that it's one of the most painful conditions known to man. And so a flare-up is undesirable, to say the least, and requires a lot of different medications. And the glucagon agonists, here again, may be used to be treated and prevent gout. So another indication for the glucagon agonists. Next slide, please. Well, this is the group doesn't need to be told anymore about red meat increasing cardiovascular disease, increasing diabetes. But here's another article that's linking processed foods to type 2 diabetes. And as you know, type 2 diabetes is commoner with us than any other ethnic group. And so we should be less likely to be eating processed meat. And one of the things that we're bombarded with on a daily basis is processed meat commercials. Almost as if you don't take processed meat, you're not an American. You look at this last data, reducing the consumption of processed meat by 1/3 could prevent more than 350,000 cases of diabetes over 10 years. And so the possible benefit of somebody like Kennedy making an effort to decrease the use of processed foods is desirable. That's one aspect of just taking over that would be desirable. Because one of the things that we have too much of is chronic diseases. And chronic diseases are fed by processed meats, processed foods. So any other comment or share any thoughts about this? Some would say we talked about it ad nauseum, but
so does would that increase if Kennedy has his way? Would that increase the cost of meats and of fish and chicken for the most part?
I don't know what effect it will have because I don't know exactly what his plans are for decreasing the amount of processed foods that we eat. But I do know that that is one of his greatest areas of concern, of recognizing that processed foods, meats as well as others, are damaging and are among the reasons why we have so much chronic disease. So I anticipate that a lot of his focus will be doing or emphasizing that. Now, your question is, will that result in increased prices? I don't know because I don't know exactly what approach he will take. I'm not sure he does either, but he'll let us know if he's confirmed as Secretary of Health.
Dr. Callender, what exactly is processed food? Is it my pizza I buy from Pizza Hut? Is it food in the can? Is it my Chipotle? What is exactly a definition of processed food?
Well, definition of processed food is food that is treated, whether it's by putting giving animals different products, or by actually processing, preparing the meat in such a fashion that it is toxic because that's really what happens, is that the meat then becomes poisonous to us. And so there are many ways that the food can be processed to make it toxic. I guess one of the good examples is the way beef is made, so that it is treated in such a fashion that it will be indestructible. But yet that way in which they make it indestructible makes it toxic to our bodies. And so I don't know. Anybody else want to talk about the many different ways of processing? We had an article on that, I guess, a couple of weeks ago, which talked about the ways in which we have processed the food to make it more tasty, but more toxic to us. Darryl has talked about it ad nauseum. Darryl, any comments?
Oh, absolutely. Okay, processed food is any food that's been changed from its natural state by cutting, washing, heating, adding preservatives, nutrients, flavors, salts, and so on. So this article is talking about processed meats, which is typically lunch meats, sausage, and lunch meat, sausage, and bacon. Those are, the primary culprits. As far as other ultra processed foods, cereals. Um, the inedible parts are removed. They're generally low in fiber. Frozen meals. Just to keep them in their frozen state, they have to add a lot of chemicals. Processed meats, we just talked about that. Cookies, that's an ultra processed food that's lower in nutrients and fiber, and higher in sugar, fat, and salt. Potato chips, they're so tasty, they're addictive, but they're terrible. They're heavily processed. Mass produced or packaged bread. We're a bread country. Well, that bread is killing us. And fruit snacks. They talk about sugar free, but they're loaded up with a lot of other stuff to make it tasty and addictive. So there you go. Processed foods, they're everywhere.
And then, of course, the one thing that we have not yet to tackle is the microplastics, which is another source of contamination, which we will have to deal with after we deal with the processed foods. And I think Kennedy may have some ideas about dealing with the microplastics as well.
Yeah, because all the processed foods are put in plastic.
I have a question about plant-based products, especially the no meats or whatever they call that. Aren't they processed?
Yes.
Very processed.
Yes. That's
It's
the problem with them, is that they're as processed as the others.
Anytime you get fake meat, highly processed just to make it hold together. So whether that's a veggie burger, there's all kind of so-called chicken products, and most of them, not all, but most of them you find in the frozen food section, which a lot of chemicals are added just to make them a frozen meal. So anytime you're eating fake meat, it's really bad for you.
One other question. I heard that, and it could be wrong, that frozen vegetables are better than canned vegetables. Darryl, answer that.
Well, you got to give me a minute to Google it.
Oh, okay. Yeah, because they said canned because of the sodium and all that is processed. But in old times, and I remember helping mama can foods, you know, and I don't know, is that so much as today when we're canning, buy canned green beans rather than frozen green beans? Or as they say around here, what do you call them, string beans or something like that? I'm from Indiana, so I'm still saying green beans.
Okay, well that's easy. As far as can, frozen is always better than can. Fresh, I would just assume is going to be better than frozen.
Okay, and of course, the shift to plant-based protein is the answer to the question, and moving from one to the other is desirable. There's so many articles that confirm the benefit of moving to plant-based protein over meat-based protein.
Yeah, okay, they emphasize plant-based being beans and nuts. Beans are legumes, but they don't talk a whole lot about dark green leafy vegetables, kale, collards, turnips. They're very high in protein as well.
Okay, now okay, what's the next
Darryl,
article?
I'm sorry, Doc. Darryl, what about spinach? Popeye spinach.
Spinach is good.
Yeah, high in protein. It's a man-made hybrid, and spinach could cause some digestive issues. Um, there's another side effect, but no, I'm not a fan of spinach.
Well, you're not a fan of any hybrids.
No, I'm not. Not man-made hybrids. The natural hybrids like apples, big fan. Man-made, we don't do it right.
Okay. Ready for the next article? This is an interesting article which talks a lot about different consumptions of water, and it starts off talking about eight cups being what you should have, and it talks about 2,000 to 4,000 cc's a day. And then the bottom line is that he concludes that it's difficult to drink too much water, but you should drink as much as you can. And this shows how the water is absorbed as it goes through the kidney and the different tubules of the kidney and results in urine. The one thing is clear, that you can drink too little water. It's kind of tough to drink too much water, but that can happen as well. But if you stick to 2 to 4 liters a day, I think you can't go wrong. We talk about 8 cups a day as being okay. But for the most part, it's tough to drink too much water, but around 2 to 3 liters a day is probably safer. But yes, you can. There's such a thing as water intoxication. But Dow first and then Sylvia.
Okay, well, my comment, since it's good old winter time and it's now 5 degrees in Chicago, and there's all that dry air, and we are people of color, in other words, black people, and we get ashy. So what's the best thing you can do for somebody who's ashy?
Drink water.
Absolutely. We think in terms of give them some lotion, give them some shea butter, but actually, water is the best thing you can give them because, okay, sebum, that's the oil in your skin and your hair, and when you're dehydrated, you don't produce enough sebum, and when you don't produce it, you get ashy skin. So that's a symptom of somebody being dehydrated. And so if you want to do something for them, don't give them the lotion. Tell them to, or give them a glass of water, and that's a lot more beneficial. And we are people. Let's see. There's no race on the planet that has more sebum production than black people. We're high in sebum. It's oil. We have more oil. The more melanin you have, the more oil you have in your skin and your hair, and it's protective. For example, okay, it's protective if you have sebum in your skin. That's why black don't crack. because it keeps your skin supple. It defeats the, when you age, your skin dries out. But if you're black, you got sebum in your skin, it makes your skin look younger, prevents aging, and in your hair too. So you got to keep to keep your sebum effective. You hydrate. You avoid hot showers. It's tempting when it gets cold to take a hot shower, but you take that hot water strips away the sebum from your skin. It'll make you ashy. So you want to avoid ash, lukewarm showers, lukewarm baths. Don't make it that hot. Another thing, we got children, grandchildren, and a lot of them are on birth control pills. That's something that can reduce the amount of sebum. So, maybe an alternatives. I'm not a fan of birth control because it's physically harmful. A lot of us have harsh chemicals can decrease the amount of sebum that's available. And a lot of our black women get those harsh chemicals through hair relaxers. So, I'm a sebum person. God blessed us with it as black people. Let's do all we can to hang on to our sebum. That's SEBUM.
Sylvia?
Yeah, I was you were talking about can you drink too much water? Now, my mom who's 93, her doctor has told her to cut down on water because her sodium level was low. So
Water
I was like,
intoxication. Water
yeah,
intoxication. That's correct.
oh, water detoxification. Oh, okay, because
Yeah.
she was like, well, I'm drinking plenty of water.
Well, that's the problem.
Okay.
Yeah.
Okay. They told her to cut back because of the sodium,
That's
lower in
correct.
sodium.
That's right. And
But
we call it water intoxication. In other words, you can drink too much water, but it's unusual. And one of the first manifestations is that the sodium gets low. And so, and when that happens, then you have to cut back on the water. So
I see. Are there any I mean, what's the consequences of water detoxification?
kills you. Kills you.
Oh, shoot. Okay.
It kills you, yeah. Because you get hyponatremia. And so therefore you cut back on your water intake. So that's why this article talks about 2 to 4 liters, and it does admit that yes, you can drink too much water. And when you drink too much water, you get water intoxication, hyponatremia, which can become fatal if it's not dealt with appropriately.
Dr. Callender, I was at the Black History swim meet a couple years ago, and DC had a sign up, advertising to drink tap water. And I remember I did a test with my high school students about their favorite water to drink. I had 6 different kinds of water, brand names, bottled water, sparkling water, and tap water. And it was a blind test. They liked DC tap water best of all the other ones. So, but my question is, what about tap water? Is it okay? Do you have to drink all that bottled water with the microplastics in it?
Well, I think that most of the tap water that we study seems to be safe. But do you have to drink the bottled water? You don't have to, because they've done tests recently that said that tap water was okay. But I think the history is such that many people don't actually believe it. So they buy all those bottles of water.
So where does that bottled water come from anyway?
Well, I don't know, but it's sterile. It's water that's purified, and I don't know exactly where they get it from. I wish I could answer that one, but it's supposed to be theoretically purified. Okay, let's see. I see Janice and Darryl.
Yes, and if we answered this earlier, please forgive me. this hits right at home with me. I'm always being told I don't drink enough water. I'm drinking coffee now. You can go most of the day and not have water. What negative effects does that have on the body?
Oh, you get dehydrated, and it affects the kidneys as well as all other parts of the body. So that having water is very healthy, and the more you drink, the better for the most part, unless you drink more than 4 liters a day. But so that the benefits of drinking a lot of water and complications from not drinking enough water. Dehydration, of course, is something that is undesirable and is associated with many negative consequences, including kidney disease and other things. Darryl, do you have another comment?
Yeah, John Buchanan was asking about the source of bottled water. In a lot of sources, it includes public tap water. Sometimes they just pour tap water in a bottle and sell it to you. It can be boiled as far as purified. It can be distilled. It can come from springs, wells, aquifers. So it's a crapshoot, but bottom line, bottled water is coming in a plastic bottle, so you're getting those microplastics. As far as tap water, most of it is pretty good. Depends on where you are. If you live in Flint, Michigan, not so much. If you live in Jackson, Mississippi, where the tap water is brown, not so much. So there's some things you could do to hedge your bet. Hedge your bet. Like I have well water with a water conditioner. I run it through a filter, so I'm really kind of proud of my water. I love the taste. Um, Robert Kennedy, he's not a fan of fluoridation that we do with our water
Yeah,
supply in most public tap waters.
yeah,
Um, and in Europe, they don't. They ban fluoridated water in Europe for the most part. It is not proven to be a decay preventative orifice as far as dental, but the fluoride companies, they pay politicians to make sure that their product gets into the public water supply. So that may be one benefit of Robert Kennedy if he can get fluoride out of our water system.
and if he can get processed foods out of our system as well. Betty?
Yes, I heard Darryl say his water is filtered, and that's what I was going to say, that, put a filter on your tap water and instead of buying all the bottled water.
Any other comments that you want to share? Okay, let's go to the next article. This is an interesting article about what foods to avoid with you've got prostate cancer, which benign prostatic hypertrophy and prostate cancer are very common in men of all men, particularly black men. And this study shows that if you were primarily plant-based diet compared to meat-based diet, you would have less likelihood of having prostate cancer. And so there's so many benefits of having a plant-based diet. And this article just emphasizes it more, that for prostate cancer, studies have now demonstrated that the plant-based diet is preferred and is less associated with prostate cancer than the meat diet. And this also talks about the fact that insulin resistance is a consequence of a lack of carbohydrate restriction. And this also goes along with increased incidence of prostate cancer. So I guess the bottom line is that so much of what we eat has to do with many of the chronic diseases that we wind up having as we age.
Excellent.
My dad had prostate cancer for the last 20 years of his life. And let's see, when I turned 50, my PSA was I think 2.5, and I was a little concerned that I was on the same path to prostate cancer as my dad. And a few years later, I was with a running club, and one of the guys on the club was an oncologist who said that he recommended his patients go vegan, and the ones that did, their cancer was controlled and stayed in remission. So that's when I went vegan. And my PSA numbers kept consistently reducing. They're currently zero point 0.8. So, it's anecdotal, but for me, the plant-based diet is turning around my path to prostate cancer.
Thanks for sharing. Any other comments? Let's go to the next article. Can we fight? Actually, I think this is it's kind of nonsensical. It's not social media's promotion of junk food that is so bad. It's the commercials and all the other things. Social media is problematic, but not as problematic as the way TV targets eating a poor diet, and junk food is what is popularized. You can't see anything but junk food or alcohol. Those are the two popular things. And you'd almost think alcoholism is healthy. And you definitely think junk food has got to be healthy. And so if they include TV as social media, then fine. I saw somebody's. I thought I saw somebody who wanted to make a comment. But
Dr. Callender, this is Sylvia. When they said the social media, like I look at a lot of the the YouTube and the TikTok, and I do see a lot of individuals making all kinds of I'll say creative and concoctions, and they're using food, a lot of cheese, a lot of milk, and bread. So I think social media does have an impact on the junk food, because people are making all kinds of, putting spaghetti. Let's put it in the oven and cook it and add the cheese and the sour cream and the cottage cheese. Ugh. But I see that. I see a lot of that going on social media. So it's the processed foods, more use of processed foods to make more creations that people say, let me try that. So they're creations, but I don't particularly like them. But I say, wow, that is too much. That's an overload of sugar. That's an overload of cheese. That's
John Tatum?
No questions.
Oh, okay. All right. Well, I think that it's clear that the promotion of processed foods and the like and alcohol is something that media is just gone crazy with it. But it's all about making money. And it's just that when you see that, remember with that presentation by one of our doctors who talked about genocide and how they're trying to kill Black people. Well, they actually, and they're not really exclusive, Black and white people. They're just killing people. I don't think that they necessarily are just killing Black people. They're killing white people, Black people, anybody who will listen to the stories they want to tell. So I think it's important for us to not believe the hype that you see on television that makes you think that drinking alcohol and junk food is necessary in order to survive. Any other comments or thing you want to share? If not, we'll move on to the next article. This is an interesting article that, as if you're not getting enough vaccines. The BCG vaccine is the vaccine that they use for TB, prevent TB. And you say if you combine this with the COVID vaccine, that you protect against the development of long COVID, which affects something close to 20% of people who get COVID. And the study they did here showed that this was less common among the people who actually got this BCG immunotherapy. This is an interesting study that was done in Brazil, and so its relevance here is interesting, but it's not something that we have done here. BCG was something that was done more in England and other European countries, more so than the United States. What is interesting is what impact Kennedy will have on any vaccines, since he's anti-vaccine. But fortunately, we've already had the 100-year disease, COVID, and so we had the vaccine that saved millions of lives. So we've got another 90 years to wait for the next one. Maybe. And this is a study that GLP-1, the glucagon agonist that we've been talking about from the beginning of the program, holds promise for addiction and for many other things. And so this is a drug that is increasing in popularity. Every week we see more articles on what else glucagon agonists prevent. So time will tell. The data is suggestive, and time will tell. But it looks as though this drug has many effects on the brain centers. And these effects are helpful for stamping out man's desire to overeat and the urges that go along with addiction. So time will tell, but it looks promising, as though remember it was also thought it might impact Alzheimer's. Time will tell on those things. So in the next year or two, we'll get more and more evidence on it. So. But I think somebody made a comment that is very telling, and that is it is expensive, but it is underproduced, which is interesting. So that when you get the mass production, maybe the price will go down as well. Is this the last article? Because we're at 10:30. So we'll make this.
6 more articles.
Well, we'll stop here. It's 10:30.
Right.
Okay. Interesting session. We had a lot of great discussion.